Hello, this is a video about high-risk drugs or drugs which have narrow therapeutic index where the margin between therapeutic dose and the toxic dose is narrow. So if we start with theophylline is used in asthma and COPD. I find it difficult to remember the the optimum plasma concentration and side effects and basically cautions as well. So this video, the main emphasis to remember those three three aspects. So if you look at monitoring, the letter theophylline starts with T. So the optimum plasma concentration is 10 and 20, which both start with T. So it's 10 to 20 milligram per liter. And if we look at the side effects of theophylline, it's basically the GI. Most side effects are nausea, vomiting, gastric irritation, and so on. It's GI problems. And the T basically is a filler, but the HE stands for headache and heart problems. Remember, theophylline causes excitation, palpitations, and tachycardia. So remember, um, the headache and heart, the HE for headache and heart. And for cautions, remember, it's cautions for high temperature or fever, hepatic failure, heart failure, where the concentration of theophylline is increased in the blood. So also look at the letter H. So it's cautioned in hypokalemia, hypothyroidism, hypertension, and also in the elderly and excitation for it could elderly and epilepsy and excitation, because remember, anytime where the CNS or the cardiovascular system is excited, whether it's hypertension or insomnia or tachycardia or palpitation, it's also caution. Also GI problems like ulcer, also in smokers and alcohol. So the concentration of theophylline in smokers is reduced, and in non-smokers it's increased. So if a smoker quits smoking, then you need to reduce the dose of theophylline, since smoking increases the clearance of theophylline. And patients who take alcohol, when it comes to interactions, theophylline plasma concentration is increased by enzyme inhibitors and is decreased by enzyme inducers. So at the end of this video, we'll see some enzyme inhibitors and inducers. So for the mechanism of action, it's basically not fully understood, but it's thought to um, relax smooth muscles of the bronchioles and the airway, so opening up the airway. It's also got some stimulant effects like catecholamines, like epinephrine, basically causing sympathetic activation like palpitation and tachycardia. And if we continue, the next drug is phenytoin. Phenytoin is also a high risk drug that has narrow therapeutic index. So if you look at monitoring, it's also 10 to 20. So remember, for both theophylline and phenytoin, the letter T is 10 to 20 milligram per liter. So if there was another option which said 30 or 40, then it's easy to exclude that you have the 10 to 20 milligram per liter for optimum plasma concentration. So for interactions, phenytoin is very complex. It's enzyme inducer, so it has many interactions. So look out for interactions with hormones, warfarin. Basically, just have to look it up. Also with some anti-epileptic drugs. For side effect, it's so difficult to remember side effects for phenytoin. But if we divide all side effects phenytoin with this mnemonic age. For the A stands for appearance. So if you remember, phenytoin causes acne, hair growth, coarsening of facial appearance, skin rash, and all side effects associated with appearance. And also in toxicity, it causes nystagmus. So if you remember appearance, and the G stands for GI, so it causes vomiting, constipation, nausea. And if you remember that, and the third is excitation, it causes insomnia, nervousness, tremor, dizziness, headache. So if we look at these three, and also not remembering, not forgetting the blood hypersensitivity and skin reactions where I um, put under caution. So it also causes problems with leukopenia, granulocytosis. So if you look at symptoms of infection, or you see symptoms like um, Steven Johnson syndrome or toxic epidermal necrolysis, a severe hypersensitivity reaction, then it's one of those side effects of phenytoin. So if you remember age and BHS for phenytoin, you could remember most side effects with phenytoin. So for contraindications, it's remember for heart disease, for like severe heart disease, block or arrhythmias. So you need to be careful with phenytoin and acute porphyria, as I said. Cautions: reduced heart um, function and respiratory depression, and BHS, which is blood hypersensitivity or hepatic problems or skin reactions. So remember blood hypersensitivity, hepatic, and skin reactions for phenytoin. Mechanism of action is thought to reduce the fast inflow of sodium ions into the cell, which are thought to increase risk of seizures. So if you reduce the or block the flow of sodium into the cells, then that reduces the threshold for seizures. It's also thought to increase the inhibitory GABA receptors as well. So if we go on, the third drug is carbamazepine, which is also anti-epileptic drug. Also, if we start with monitoring, it's 4 to 12 milligrams. So if you just remember carb for 4 letters, it's difficult to remember. If that helps you, I usually look at the letter carb and just think 4 to 12 milligram, and there's no other medicine. At least these high risk drugs in this video that starts with 4 to 12 milligrams. And the letter MA is just interesting. Remember, carbamazepine should not be used in myoclonus and absence seizures. So the MA, if you know, it helps you in any way. And for side effects of carbamazepine, it's interesting. So if you look at all the side effects of carbamazepine, there are antimuscarinic side effects like dry mouth, constipation, um, glaucoma. So if you remember, if you look at the structure of carbamazepine, it looks like tricyclic antidepressant. So it's no wonder that it has antimuscarinic side effects. Also, if you look at the side effect, it's symptom of drunkenness. It's like vomiting, ataxia, dizziness, drowsiness, headache. So all symptoms of someone who's drunk, and also blood and hypersensitivity and hepatic and skin disorders like phenytoin. So remember, antimuscarinic side effects, all symptoms of tipsiness and blood, hepatic or hypersensitivity and skin reactions. It's also enzyme inducers, so many interactions with enzyme inhibitors and inducers. Although it's inducer, it's also inhibited by inhibitors. And if you look at the contraindications for um, carbamazepine, it's cardiac problems, severe cardiac disease, especially conduction abnormalities, and bone marrow depression for this B, and also acute porphyrias. For cautions, remember blood, hepatic or hypersensitivity, and skin reactions. And with patients with just this genetic trait, it's usually thought in patients with Chinese and Thai ethnic who have risk of toxic epidermal necrolysis and Stevens-Johnson syndrome with severe skin hypersensitivity reaction. Again, the mechanism of action is thought to reduce the voltage dependence of sodium channels in depolarized neurons, which reduce risk of seizures. Um, if we continue, the fourth one is phenobarbital. So we start with monitoring. If you look at phenobarbital, it starts with like 15. So if you look at 15 to 40, both 15 and 40 is like pheno 15 40. So if that's going to help you in any way to remember in an exam situation. And the R stands for absence seizures. Phenobarbital is not used or is cautioned in absence seizures. So remember phenobarbital. Interaction is very complex. Enzyme induces, so it has a lot of interaction. So you just have to look it up. When you look at side effects, it's basically excitation or depression of CNS symptoms, and also blood, hepatic, and skin reactions. If you look at all anti-epileptic drugs, remember BHS, blood um, problems, hepatic, and skin reactions. So blood hypersensitivity, skin or hepatic problems. It also causes nystagmus, hallucinations, impaired um, memory and cognition. So basically, either excited or depressed CNS symptoms. It's and if you look at the cautions and the contraindications, it's basically it's cautioned in severe or debilitated patients. For example, in the elderly, in respiratory depression, um, in alcohol withdrawal, and so on. So basically, if someone is severe has severe impairment or debilitated or uses substance, then think again in using phenobarbital, as it could cause problems. As we said, it either excites or depresses the CNS. The mechanism of action is thought to prolong the depolarization of channel chloride ions. So basically, it increases the refractory time where the neuron is not um, able to propagate another action potential. So it hyperpolarizes the neurons. If we go on, is the other one is digoxin, which is used in atrial fibrillation and heart failure. Um, Digoxin is also a narrow therapeutic drug. So if you look at all the drugs which we have looked, they are all milligram in liter. So to remember digoxin, it's microgram per liter. It's not milligram. And the optimum plasma is thought between 0.8 to 2. Risk of digoxin toxicity increased above 1.5 to 3 micrograms per liter. And if we look at interactions, it increased by calcium channel blockers, antimalarials, antiarrhythmias, antifungals. It's also increased by cyclosporin, colchicine, St. John's wort, selective serotonin reuptake inhibitors, and diuretics, including spironolactone. So, if you remember, the common characteristic between all these are being enzyme inhibitors. So, like amiodarone, the antiarrhythmias increase the concentration of digoxin, antimalarials like quinine, hydroxychloroquine or chloroquine, itraconazole, all calcium channel blockers, the hydropyridines and the non-dihydropyridines like verapamil, diltiazem, lercanabine. So all of them increase the concentration of digoxin. And remember, St. John's wort, selective serotonin reuptake inhibitors, cyclosporin, and colchicine, and diuretics. And for contraindications, for digoxin include heart block. Also, it includes ventricular arrhythmia. When we come at the cautions for digoxin include also patients with reduced heart function, for example, a recent myocardial infarction or thyroid disease, or look at this H. It's very important. When I wrote this, the H stands for hypokalemia, hypomagnesemia, hypercalcemia, and hypoxia. So if you look at the H, it's very significant. The hypo, and oh, that H is basically for heart. So I've wrote it here. The hypokalemia, hypomagnesemia, hypercalcemia, and hypoxia. So it's 3 hypo and 1 hyper. And also for respiratory depression. So remember, thyroid disease, heart disease, elderly, um, hypokalemia, hypomagnesemia, hypoxia, hypercalcemia, and respiratory depression. So the hypo. When we come at side effects, it's basically GI symptoms, for example, diarrhea, nausea, and also it calls yellowing of vision, and also eosinophilia and respiratory, rash or skin disorders. So if you remember, GI problems, yellowing of vision, eosinophilia, and rash. So you could remember most of the digoxin side effects. And if you look at the mechanism of action of digoxin, it's thought to increase this membrane enzyme, and then increase the concentration of calcium in the intracellular cell space, which increases the force and velocity of myocardial and systolic contractions. It also decreases the heart rate, so negative chronotropic effect. So if we go on, methotrexate, it's used in cancer, in psoriasis, rheumatoid arthritis, inflammatory bowel disease like Crohn's and ulcerative colitis. For monitoring purposes, there's no optimum plasma concentration, but we just clinical um, parameters like blood for signs of infection like sore throat, liver, pulmonary toxicity. You do full blood count and renal function, because many drugs reduce the renal function, um, which reduce the renal function cause high concentration of methotrexate and increasing the risk of serious infection. Also, interaction is the most important is NSAIDs. Basically, people who take methotrexate should not buy over-the-counter medicines like ibuprofen or naproxen. Also, they should not take trimethoprim, which also blocks folate, basically increases the site concentration of folate in the blood, causing a granulocytosis and the risk of infections. And cyclosporin and clozapine and all medicines which depress the bone marrow. So remember, for methotrexate, medicines which decrease the excretion of methotrexate, like NSAIDs, the trimethoprim, cyclosporin, clozapine, or bone marrow depressant should be avoided. For side effect is blood, for example, symptoms of granulocytosis or leukopenia or anemia, liver toxicity, pulmonary toxicity, GI problems, ulceration, cardiac problems, psychiatric disorders. So there's a lot, more than 50 side effects for methotrexate. But if you remember the side effects of blood, liver, pulmonary, GI, cardiac, and psychiatric disorders, you'll go a long way. And for contraindications for methotrexate include heart block, um, pericarditis. Um, so basically, any condition which causes severe infection, for example, blood infection or liver problem, someone who has severe liver disease or a pulmonary disease, so you need to avoid methotrexate. You need to also ulcerative colitis as well, because of the risk of bleeding, and also immunodeficiency. For example, someone who's taking someone who has HIV or elderly or any condition where there's deficient immune system, then it's risk to use methotrexate. Also, it's teratogenic, so it should not be used in pregnancy. And people who take methotrexate should avoid conception and then for 3 months after finishing methotrexate. Mechanism of action: it's thought to inhibit dihydrofolate reductase inhibitors, which is an enzyme which metabolizes the uh, DNA basis. So it basically blocks the synthesis of new DNA. And then warfarin, which is basically used in atrial fibrillation, DVT, pulmonary embolism, and transient ischemic stroke. Um, Monitoring, it's basically daily in the first few days, and then it's increased. Interaction is very complex. It's increased by enzyme inhibitors. It's reduced by inducers. There's also think pharmacodynamic interaction like selective serotonin inhibitors, antiplatelets, any medicine which increases the risk of bleeding. There's also a lot of interaction with food and alcohol. So you need to think if someone is taking warfarin to avoid medicines which increase the risk of bleeding, because any medicine that increases the concentration of warfarin has the risk of causing um, significant bleeding, especially GI problems. And for the side effects, it's mostly GI problems like nausea, vomiting, diarrhea. It also causes hepatic problems or heart problems. Um, it's also risk of pancreatitis and skin disorders like rash, purpura, alopecia, and so on. There's also risk of when you look at the skin rashes, something called calciphylaxis or calcification of blood vessels. So if someone is taking warfarin and develops rash, then they need to seek a medical attention because of the risk of calcification of blood vessels. So we said for side effects, look for signs and symptoms of GI problems, hepatic problems, um, is symptoms of pancreatitis or pyrexia or purpura, and skin reaction. So think of a way you could figure out to remember. So if you say GI HEBAS, it's just a cue to make you remember. If you look at a list of side effects, they could give you some cue to remember. A contraindications, basically it's no brainer. It's risk of bleeding, for example, hemorrhagic stroke, or um, if a woman gives birth within the first 48 hours. So basically, risk of bleeding, and cautions usually include bleeding, risk of bleeding, and infective endocarditis. Mechanism of action: it blocks the synthesis of the extrinsic pathway of the clotting system, factors 2, 7, 9, and 10. Um, if we go on, is the other one is lithium, which is used in mania and hypomanic episodes and severe depressive illnesses. So the monitoring is zero point 0.4 to 1 millimole per liter, and it's thought that serum level should not exceed 1.5 millimole per liter because of the risk of toxicity. Above 2 millimole, it's very risky concentration. And if we look at interactions for lithium, it include Mr. NSAID, or the M stands for methyl dope, risperidone, NSAIDs, NSAIDs which should not be given with lithium because it reduce the excretion of lithium, thereby increasing the risk. Also, diuretics are risky with lithium. They could increase or decrease the concentration of lithium. Also, amiodarone, acetazolamide, and selective serotonin reuptake inhibitors. So, Mr. NSAIDs, remember Mr. NSAIDs, and then these cues to remember significant interactions. So, for side effects of lithium, there's a lot: GI, CNS, cardiovascular, skin, renal, eye. So basically, there's no system where lithium doesn't cause problems. But if we look at just the signs and symptoms for lithium toxicity, it include tremor, ataxia, diarrhea, nausea, um, um, renal impairment, convulsions. So if you look at those, then I think you could go a long way to remember the interactions for um, also confusion as well. So remember those. for lithium toxicity. And then if you look at the contraindication, it's basically low sodium, um, or severe insufficiency. So every contraindications for lithium is basically dehydration, low sodium, and so on. So if you see something with low hypoinsufficiency, it means it should not be given with lithium. Mechanism of action is basically not known, but it's thought to increase the concentration of serotonin and reduce the concentration of dopamine. That's why the risk increases with um, selective serotonin reuptake inhibitors. So if we go on, as I said, enzyme inhibitors and inducers, these medicines are all substrates for many cytochrome P450 enzymes. So any medicine that inhibits or induces these enzymes will increase their concentration. The inducers include many anti-epileptic drugs. So you just think of anti-epileptic and anti tuberculosis and St. John's wort. So if you just remember anti-epileptic, anti-tuberculosis, and St. John's wort, you could remember all inducers. For inhibitors, there are a lot. If you remember, antifungals, macrolides, fluoxetine, and the selective serotonin reuptake inhibitors, and antivirals, quinolones, proton pump inhibitors, the H2 inhibitors, cimetidine, acetazolamide, antiarrhythmias, isoniazid, disulfiram, grapefruit, cranberry juice, metronidazole. There's a lot. But as I said, if you just remember the class of drugs, then you could remember most of inducers. Some there are some mnemonics which are used to remember some enzyme inhibitors and inducers. So inhibitors for these, and for inducers these. But I find just remembering that the anti-epileptics and John's wort and rifampicin induce enzymes, and the most inhibitors are basically macrolide antibiotics, some anti-HIV drugs, um, quinolones, cimetidine is very important drug. Um, Also some selective serotonin inhibitors. So anyway, it's easy for you to remember. So it's up to you, whichever is easy for you to remember.